This is quite a special day, as you said, today. Not only because it's Rare Disease Day, but it's really some kind of celebration. This morning we had a great event at the Commission, hosted by Commissioner Vassiliou, for the launch of this book. It was really a very nice present that the Commission made us by calling it the Rare Disease Day book launch. We didn't know it, we discovered it. We were trying to promote the book for sure, but we didn't know it would be a launch of the book like that. So that was really great. And for very kind words and very supportive words of the Commissioner Vassiliou this morning, as well as of the Czech Republic EU presidency representatives, who said that they will do everything they can in order to adopt the Council recommendation by June. Now, in advance, I would ask, or I will present my apologies for the one we were present this morning, because obviously I will repeat some of the elements, but then you have a second chance to remember it. And there is a quiz at the end of the lunch, so be ready for it. Take good notes. And you can see that we are really fighting for rare diseases since a long time, because now I need my glasses to do that kind of exercise, which I wouldn't a few years ago. So Rare Disease Day is definitely for us a public awareness campaign. It is an initiative started by the national alliances inside Eurordis, because we have 16 national alliances across Europe, and they decided to have a campaign together each year on rare diseases. And the first one was last year on the 29th of February, this rare day changing each year. And this year is the second edition, but it is already a worldwide campaign, which goes beyond really our control, because this year there is 200 patient organizations and companies and public administration in the USA, for instance, who are taking part. Canada is taking part, Brazil, Argentina, New Zealand, Australia, China, Taiwan, Russia. So it's great. We are almost crying sometime when we receive all these emails and informations. And we have chosen for 4 years, from 2008 to 2011, a common theme for these 4 years for the campaign, which is rare diseases as a public health priority. And you may remember, for the one who are following our trip, I would say, in a public policy, that we published this paper a few years ago, which was understanding this public health priority. Thank you, Flaminia, for this wonderful paper translated in many languages, and that has helped really to shape some of the key arguments and language of why there is such a strong added value of working together at the European level. But the specific topic of this year for the Rare Disease Day is a focus on care. And that's why we have that slogan of patient care, a public affair, which really try to ring a bell on the mobilization of care for rare diseases. And for that purpose, based on 4 years of work, we have published this book that you're all familiar with. And in case you missed it, it was in your plate when you arrived today. And that's part of the quiz also at the end of the lunch, of the dinner. And with this book, what we want to do is really to bring to the surface a lot of the experience and of the expectation of patients and families on accessing diagnosis and care for rare disease in Europe today. So what you have is really the experience of 12,000 patients from 24 different countries, 18 different rare diseases, 12 different languages for the survey, in order to produce data, not to be only on anecdotes, which is so much of a problem, because as we were just discussing, one of the major issues we have to address is the lack of knowledge about rare disease in general, and that includes lack of knowledge in terms of public health. So for that purpose, and I skip some pages because I don't want to repeat too much of what we said already and discussed this morning, is that with these surveys we believe we have been able also to show that patients' organizations are not only providers of information, of supports or advocates, they are also a source of solid data for public health and for policymakers. And that was also in the intent of this work. What we need to keep in mind before discussing these policy aspects, such as the Council recommendation, is some of the key issues. We all know that there is between 5,000 to 8,000 rare diseases, this large bracket, maybe around 30 million people affected. But what we know more for sure, based on the publication, on the scientific data, is that 75% of them are children, and that about 30% of them die before the age of 5 years. And this is what we want to improve, definitely. What these surveys have showed, in addition to what is already published in the scientific literature, is that there is very long delays in accessing care. It is a maze today in Europe to access diagnosis, and it can be up to 5 years or up to 30 years to have access to the right diagnosis for these diseases. But even more important in our view is that 40% of these patients have had a misdiagnosed before being rightly diagnosed. And that means that they had to undergo treatments, surgeries, psychotherapies which were not necessary and which were harming them and their family. Another important point from this survey is that we know from the experience of the patient that they need, on the average, 9 different essential medical services. And that can be up to 12 different essential medical services in a year. And for a lot of them, they have difficult or impossible access to them, and that can be up to 1 out of 4. So 25% of the patients having difficulties of access to these essential services. On the top of it, and I think that's a major concern for us in the Council recommendation, is that we would like to see a little bit more focus on a comprehensive approach between the medical care and the social care. Because what patients are saying in these surveys is that they have 3 times more difficulties to access social services, and they are much less satisfied with the social services than with medical services. And that may differ from one country to another, but it's something across Europe. What is also important from this work is to see that although we have so much different diseases and different situations of healthcare system, and we always hear that, yes, but how to have a common policy with so different healthcare systems from one member state to another? Yes, that's true. But what comes at the surface from these surveys is that for 95% of the patients and the parents, among the 12,000 patients who have answered, they say common things. So there is a common rare disease community, that we are representative, a social entity, and what they are saying is that they want centers of expertise, they want it multidisciplinary, they want it to good communication between the experts in the hospital, in the center of expertise, and they want good communication between them and the healthcare professionals in the community. So all that is not quantitative, but it is really qualitative approach. It is an issue of policy, of organization of healthcare, and of practices, more than funding in this respect.